Nightlife abounds in Trinidad and Tobago. Bars, nightclubs and sushi joints sit cheek and jowl along Areopita Avenue. St. James never sleeps, and dancing and liming happens all over the country. Even as clubs change names and facades come and go, sex workers are always to be found in the night. While the industry has a long history, a significant change which has occurred in the last few years is an increase in the number of Spanish-speaking sex workers.
When I was 18 years old, I came across here to be with my mom. When I came, it was a bit tough, you know. Mommy used to, we live in the countryside, and it was hard. So I was like, I went to look for work, you know. But looking for work was so hard, so I decided, well, this year's way was to become a sex worker, and I tried to work as a sex worker and got the money more easy.
The lure of making fast money is powerful, but it comes with issues such as dodging police, immigration, and abuse. Support for this vulnerable population is limited, but since 2006, the Family Planning Association of Trinidad and Tobago reached out as it continued its efforts to provide sexual reproductive health services beyond its clinics.
We started to work with the sex workers under an innovative project which we had won an award for from the International Planned Parenthood Federation, our parent body. And we started reaching out to sex workers, and interestingly enough, the group that came forward were mainly transvestites. So that our first relationship with sex workers was through that particular group. One of the things in 2006 that we did, recognizing from discussions and consultations that we had with them, was that they needed to have access to services, they needed to reach out to their peers on the streets, and therefore they needed support in that regard, through training, through the delivery of condoms, literature, so that they would know how to protect themselves from sexually transmitted infections, including HIV.
At the conclusion of a successful project, a request came from the Caribbean Vulnerable Communities Coalition and Centro de Orientación Investigación e Integral, called CVC COIN, for FPATT to again reach out to sex workers, this time migrants.
Based on some research that had been conducted, we recognized that there was a need particularly to reach out to the Hispanic population. They were coming into the country from Dominica, Venezuela, Colombia, Dominican Republic, and what we realized is that they had no access to services. There, I think one of the barriers was the fact that they spoke a different language, and therefore they were not confident. They were fearful that if to access services, it will pose a challenge for them, one, because of the language barrier, and two, because they were here illegally, coming to provide services to those people who required sex.
The CVC COIN grant was provided from Global Fund Round 9 for a program to provide information and services to the women, many of whom had no idea how HIV was contracted, nor access to condoms. Because of Family Planning's previous work with local sex workers, the organization was able to have them reach out to their peers and be a bridge to reach women who would not otherwise respond.
In this particular project for the Hispanic sex workers, we started training their peers, because that was one of the lessons that we learned from the previous project, that we couldn't reach them. That what we needed to do was train the peers who would reach out to them, so that in the nights when they're out on the street, they would use the opportunity to educate them, they will share condoms with them so that they can protect themselves, and they develop a bond with each other, even developing ways in which they will protect themselves on the street. They shared strategies as to how to do that. They shared strategies as to how to deal with the pricing, so that you find if somebody was negotiating, like somebody who was purchasing sex, was negotiating price, they would have their strategies as well in terms of how to deal with that, so that they didn't undersell each other and didn't compete against each other and stuff like that.
Another grant was provided in 2013 through the Global Fund Round 9 via CVC Coin for outreach to Hispanic sex workers.
A friend of mine had invited me to a training they had, and I did the training as a peer educator 2 years now, and since that I've working with family planning for 8 months. As a peer educator, they taught me many different STI disease and how to go out there to help out other sex workers as I, and show them the use of condoms and all those things.
One of the challenges faced by the Family Planning Association was motivating the women to attend clinic after being awake all night. Another was reaching them before they migrated to another area or region.
It was never easy to reach out to them because you go to them and you sit there and you explain to them everything, and yes, they will say yes, they're coming, and they're not coming, and you have to go back to them again, and you're trying to encourage them to come. But if we tell about 10, I will get about 5 to come. But that wasn't nothing, because I still go back to the same 5 that didn't come to see if they will come. Because the first 5, we will treat them so nice there. We talked to them. The area where we was, we show them all the STI disease and everything, but we don't. And then we put them to draw, and we give them things to eat, to drink. And they still feel welcome. So when they go back now, they say, oh, they're telling the other 5 girls, come on, let it come. It was really nice.
There were 2 main facets to the 2013-2015 project: providing information and services, and establishing a support group. One of the lessons learned from previous training was that the women should be taught in their own language. So a Spanish-speaking consultant shared information on communication, how to discuss condoms and their use, as well as any information the peer educators would need to provide in their outreach. The net result was evidenced by the number of women who found a safe space.
Coming to use these services, the girls and them feel, when they come there, they feel, because when I go out to them, I just always tell them that particular time, that okay, if it's 1 to 3, that time there will be nobody around to see them. It will be safe for them alone, and everything there is confidential. It is right. It stays right in there, and they feel welcome, and they like it a lot. They keep asking to come back. They keep, many times they call me and they tell me, you're going to clinic today? I said, not today, but today. I say, okay, because I want to come because I need to see the doctor. Because it's feel comfortable to come there to see the doctor, They don't like to go somewhere else because people criticize them.
Peer educators worked 20 hours monthly, providing information and education to sex workers on the importance of sexual and reproductive health, prevention of sexually transmitted infections including HIV, and the proper use of both male and female condoms. All sex workers seen are encouraged to access screening services at FPATT's Port of Spain clinic, as well as invited to attend the support group sessions facilitated by their peers, which follows immediately after service provision. The peer educators recorded data on all sex workers seen on the Peer Education Data Collection Form, which was provided by CVC Coin. The peer educators prepared an agenda for each support group session, and a sign-in register is completed by those in attendance. The project coordinator provides administrative and technical support to the peer educators during the session. All data collection tools are collated and submitted monthly to the project coordinator, who prepares the report to the donor. The donor report includes statistics on the number of sex workers sensitized, the number accessing SRH services, and the number in attendance at the focus group sessions. Noteworthy experiences during the reporting period, as well as challenges faced, are also included in the report. Targets for the next reporting period are outlined in the report, and the approved reports are uploaded to the CVC Coin database. Some of the services the women received included pap smears, HIV testing, GBV screening, counseling, and medical and family health services.
We were very pleased with the results actually, because one of the things that we were supposed to reach at least 200 sex workers to provide them with services, sexual and reproductive health services. And by April 2015, we had surpassed that target already. We had done something like 267. So we were actually pleased with the result of the project. In terms of the support group, our target was to reach 30 people, to form a group of 30 people. And we had in fact incorporated 44 people again by April of 2015. So that, because as the sex workers gain confidence in us, gain confidence that this was a safe place that they can access services and that we will protect them and that we were confidential in the way that we delivered services, that trust strengthened even further, and you find that they were encouraging their peers to come in and be part of the group.
Sex workers continue to be in demand, so it is important that they are healthy as they provide services. The cost of treating HIV and STIs continues to be high, so supporting initiatives like this results in lower medical costs to the state. It ensures productive man-hours at work are not lost and that we have a safer, healthier society, as opposed to one where harsh measures lead to an underground trade where women have no access to services, training or support.
They want to continue coming. They call because they want to come back. They keep asking me, they call me, they say, so when you all starting to come back, that now that they come time, they keep calling me and telling me, so when you all coming back? So, and I decide that we will always keep in contact with them, and they could, now that they come time, they could still come into the clinic, but we will come there as well, you know, so they will feel comfortable.